In this episode, I'll be speaking with Nicole Laurent about therapeutic ketogenic diets for mental health. Nicole is a licensed mental health counselor in Washington State. She graduated from Argosy University with an MA in clinical psychology in 2007 and has provided psychotherapy for over 16 years in private practice. She completed postgrad training in nutrition and integrative health from the Maryland University of Integrative Health, and Nicole assists patients in using ketogenic diets for mental illness and neurological disorders as an adjunct to psychotherapy. She also works to educate the public regarding ketogenic diets with her blog, mentalhealthketo.com, social media platforms, and podcasts, and she develops online programs to increase public accessibility to metabolic and nutritional therapies. Recently, she was one of 7 recipients of the Metabolic Mind Award in 2022 for her contributions to the field of metabolic psychiatry by advancing ketogenic metabolic therapy. So, without further ado, please enjoy my conversation with Nicole Laurent. Hi, Nicole. Thank you so much for joining me today.
Thank you for having me, Karen. Glad to be here.
Yeah, I have been following you for a long time. I think we first got in contact with each other. Was it on Instagram? We found each other?
Well, I think it was Heather introduced us, Heather Joma.
Yes.
And that's right. And then we had because we were both interested in nutrition and mental health. And then we had a quick conversation. Remember? It was a long time ago.
I do.
And then, yeah, that was fun.
Yeah, it was. And I mean, really ever since then, I've been following what you're doing because, I know this is what we're going to be talking about today, but the idea of using therapeutic ketogenic diets for mental health and the theory around brain energy and hypometabolic brains is so interesting. And it sounds like it's been really transformative for a lot of people. So, and I really see you taking this and doing interesting things. So, there's a lot of things I want to ask you. I want to ask about some examples of case studies and how you've worked with this. But before we do, I kind of want to set the stage for our listeners who haven't heard about this. So could you, before we get into how you got into this, could you actually explain the concept of like brain hypometabolism and what that actually means?
Yeah, absolutely. So brain hypometabolism is a kind of a general term, and I'm sure it happens for different reasons for people, but the skinny of it is that brain hypometabolism means that energy is not being utilized in the brain effectively. And that is an absolute crisis. And that sets off a whole chain of events around problems with neurotransmitters, increases in oxidative stress, and inflammation. So the brain, and I know this part because I get to hang with some very, very smart scientists who are neuroscientists, and they literally study this, and they tell me, around the table, that brains as they age utilize glucose less efficiently as fuel. And that's not just people with diabetes. It's not just people with pre-diabetes. It's just people. It's just people. It's just people aging. And maybe it's because of our high carbohydrate environment, and we've set it up in such a way that the brain ends up being more insulin resistant over time. And maybe that's why brains as they age use glucose less efficiently for fuel. I don't know what the cause is, but that's what the data is showing. And so for some people, as you can imagine, that is a bigger issue than others, meaning they have a level of insulin resistance in the brain, or there's something going on in the brain where they just are not using glucose for fuel. So a ketogenic diet is a rescue fuel for people, for aging brains. And it's not just a rescue fuel. It actually, the ketone production itself has neural network stabilizing effects. So not only, and it works in many ways above and beyond just being a fuel source for the brain. So ketones that are made on a ketogenic diet, and we don't know if the exogenous ketone world is going to come in and suddenly everybody can eat what they want and just take exogenous ketones and get the same effects. So all the clinicians that work in, at least in the area of mental health, see people try that and they don't seem to get the same effects as they get when they create a true metabolic shift in the body by producing their own ketones. So I don't think there's a hack for the benefits of a ketogenic diet yet, although we do use exogenous ketones with some populations to get ketones up into a particular range. But anyways, ketones act like fuel in the brain, and they bypass this broken glucose machinery, for lack of a better word.
Yeah.
And they are really a clean burning fuel in the brain. They diffuse right in to the membranes, and they bypass broken kind of machinery. And so this is the rescue fuel, and it's important because if a brain doesn't have energy, bad things happen. It's an energy demanding organ, and it has to use a lot of energy just to upkeep itself.
I think
So
people don't
yeah,
realize that. And that's something I think we learned like early on in nutrition, that of all the parts of the body using energy, the brain is actually a real energy suck. It
yeah,
requires a lot of glucose or a lot of energy of some sort.
yeah, absolutely. So ketones are a huge fuel, but these little ketone bodies are really interesting because they're molecular signaling molecules. So above and beyond providing a rescue source of energy for the brain, they do a lot. They do a lot of things that seem to stabilize our organ systems and seem to stabilize our brain and help us function better. And that's why when you hear people talk about ketogenic diets, they talk about all these different conditions that got better. And we just sound loony. We sound loony when we talk about ketogenic
The
diets.
magic bullet. Magic bullet.
We get accused, we're told we're, loony people that are just think there's this magic bullet. But let me tell you a little bit about what ketogenic diets do that's talked about in the literature that everybody understands. Like if your people Google Scholar ketogenic diets and whatever, this stuff comes up. They'll see this. It's simple to find. So ketogenic diets are molecular signaling bodies that turn genes on and off. And some of the pathways that they affect are our endogenous antioxidant systems. So ketone production will actually help increase our endogenous production of glutathione, which is the primary way that we clean up the mess that
Well,
we make. Yeah.
you're saying that ketones signal our own bodies to upregulate glutathione production,
Yes.
this master antioxidant.
Yes.
I didn't know that.
Yes. And you pair that with what I said prior about ketones being really efficient fuel. So utilizing glucose for fuel is great, but it does create more reactive oxygen species as a fuel source. And it does deplete more micronutrients, such as magnesium, for example, and thiamine, to create energy from a glucose molecule than ketones do. And so you add this upregulation of glutathione with the change in fuel. So think about glucose as a little bit of a dirty fuel, a little bit of diesel, a little bit of gasoline. It's got some cleanups. And ketones, the easiest way to think about it is we're going solar, baby, right? And so there's less mess. There's less stress on the oxidative stress system. And so those two are really big pieces.
And in a system that is deficient in micronutrients, might be deficient in B vitamins, and is under a lot of oxidative stress, just doesn't have the reserves to deal with the fallout from glucose metabolism.
Yeah, absolutely. Absolutely. And then you add the part, so it increases that, but it also, as a molecular signaling body, ketones will go in and turn off chronic inflammatory pathways that eat up all those micronutrients, right? The oxidative stress system is eating up our micronutrient supply in order to clean up the mess of what's going on. So these little ketone bodies will literally go in and shut off chronic inflammatory responses and shut them down.
Yeah.
So that's super great for the brain. And then
Yeah.
there's all these effects on the immune system. So ketogenic diets are being used as an adjunctive therapy, a powerful piece of cancer therapy for different cancers. And part of that is the
Yes.
improvement in immune function.
I have heard this.
Mm-hmm.
Can we back up a little bit? Just because I think a lot of our listeners might be wondering, why is glucose metabolism killing us all? And they might not understand the oxidative stress involved in glucose metabolism.
Mm-hmm.
So between you and I think for those of you listening and wondering what this is, because this got pretty high level pretty quickly. When we take in glucose for fuel, and it goes into the cell, into the glucose goes in the cell, and then it goes into the mitochondria. Remember, the powerhouse of the cell. It goes through something called the oxidative phosphorylation. It uses oxygen to generate ATP. And the process of that is we use the word oxygen, it's oxidative, and it's actually really damaging. And the body really compartmentalizes all of this, in the mitochondria, in this little area, uses membranes to seal it off, and a lot of antioxidants, ideally, to manage all this oxygen in there that really, if it was unleashed, would damage a lot in the body. So if a person doesn't have all the antioxidants and good membrane stability in their mitochondria, this actually can wreak havoc and cause oxidative stress. Is that what you're talking about when we're talking about oxidative stress?
Yes. So being alive causes oxidative stress. Just being here on planet Earth, doing your thing, you will generate oxidative stress.
Mhm.
Absolutely. And glutathione is the primary mechanism by which we clean that up. I promise you all, you cannot take enough vitamin C to off-regulate oxidative stress that comes from poor eating, for example, or
Yeah.
insufficient eating.
Mhm.
So yes, that is the pathway I'm talking about.
Okay. And then, so that's that brain. So you have this brain hyporegulation or hypometabolism, where the
Mm-hmm.
brain isn't utilizing glucose effectively, and or it's just got so much oxidative stress that it's the brain cells aren't working well. They aren't creating enough energy for what they need. And you talked about how the ketogenic diet is good for so many things. But in terms of mental health, what are the things that we're seeing that are impacted by brain hypometabolism?
So yeah, so when there is, so hypo means low energy, low metabolism, brain
Mhm.
hypometabolism. So when you starve a brain of energy inadvertently and it cannot upkeep its cells, it's a beyond an energy issue.
Mm.
So although that is the piece that begins it all. So if I have brain hypometabolism, there are structural changes to my neurons that happen because that cell can't upkeep, right? If I don't have the energy to do my housework, there's going to be problems in my house, right? I can't upkeep it. I can't make it run smoothly. Pretty soon the
Mhm.
dishes are going to pile up. The lawn, like, you know. So it's like that in the brain too, to minimize it and make it very simple.
Mm.
And so there's the way the neurons and the different neural structures act when they're starved of energy is membranes get damaged. Membrane functioning gets damaged, which means receptors don't work properly. You
Mhm.
get neurotransmitter imbalances. Um, and,
All the
and
cell to cell signaling happens via
it's
membranes.
all broken. It's all broken. And then as that happens, the immune system gets involved, right? Because there's a hot mess to clean up. There's all this inflammation going on, and cell membranes are not firing hard and healthy. So if I'm a microglia and I'm wandering around looking for trouble and I see a weak signaling membrane, right, connection, I'm going to chomp it. I'm going to think it's sick when really that connection could have been saved if I had just increased brain energy. So
Right.
here I am walking around as a microglia trying to keep things clean, trying to deal with the reality that someone can't do their housework, right? That the cells can't manage.
Yeah.
And you can switch your microglia into this stage where it just does a lot of damage and it is
So
overactive.
remind
Yeah.
everyone what a microglia is and does.
Oh, a microglia is an immune cell, and it gets activated in the brain. And if you have immune dysfunction in your body, you have immune dysfunction in your brain. If your immune system is active because you've got a cold or something like that, or you've got a big inflammation source in your body, that activates the immune system in your body, which activates the immune system in your brain. And so you get microglia activation.
And we've all experienced that when you're sick. Like you
Yes.
often, like I know when I get sick, I feel like depression sets in. You can actually feel it. You feel low motivation and
Yeah.
brain fog. I've actually thought, oh, what's wrong with me? I feel like I have mental health disorders when I get
Yeah.
sick because the
Yes.
inflammation in my brain.
It's the same. That's the microglia shut, and that's important. So the immune system in the body is different than the immune system in the brain, but they talk to each other.
Mm.
So if there's an immune response in the body, signals go up to the brain to activate microglia, and that shuts you down. That makes you sit on the couch and watch Lord of the Rings and not feel like do anything, and you just can't, you just shut, it stops you. And the reason for that is your body has a load that it has to deal with in getting you well, and it can't be having you run around. So
Right.
those are sickness behaviors, and they are triggered by microglial cytokine activation.
Yeah. And so I have a backup question. This whole brain hypometabolism. Do you guys is this a theory or is it something that can be measured?
It's measured. It's absolutely easily measured, through different types of scans in different research
Mhm.
facilities. And also, a good old fashioned PET scan. So if a doctor believes that someone has Alzheimer's disease and they want to take a look at glucose metabolism, they can do that with different scans. So this is not like a theory. This is like hard data evidence. We can see your brain is not utilizing glucose for fuel.
Right.
And we can see, like, for example, there's this beautiful study done by Kanane, where you can see a hypometabolic brain, and you can see that the brain hypometabolism is indicated by like a blue color, and then they infuse them with a ketone body, and you can see the brain light up with energy where before it was not there. This is just on
I've seen
MCI
this.
patients, mild cognitive impairment people, not
Mhm.
even Alzheimer's.
Yeah. Yeah. It's really exciting.
Hmm.
So kind of switching gears to like ketogenic diets. So when you're talking about a metabolic ketogenic metabolic therapy, um, describe this. Is this the same thing that people think of when they think of going on a keto diet to lose weight?
No. So here's the thing. Some people can go on a low carbohydrate diet. And when I think of a low carbohydrate diet, I think probably they're not tracking their carbohydrate intake formally. They might just be eating off of a low carb food list and eating till they're full. They're not, you know, checking to see how high protein is, if it's moderate or high. They're just lowering carbohydrates enough that they're losing weight and they're getting some benefits, right? They
Mhm.
feel good. Lots of, like I said, lots of conditions, get better on a low carbohydrate diet. So a low carbohydrate diet used for weight loss, there is likely periods of time in which they go into ketosis and they get the benefits of those ketones, and then they go out. They're not using ketones as a necessarily their primary fuel. There's
Okay.
probably times when their glucose consumption is a little bit higher than what we would want
Okay.
on a medical ketogenic diet.
So
Some
toggling in and out of ketosis like overnight and things like
Mhm.
that, but not full
Yeah,
ketosis.
not staying in a ketotic state at a particular, ideally a particular level. It depends what we're
Okay.
using our medical ketogenic diet for too, right? So using it for mental health, and there's different. I want to talk about that just a little bit, because there's lots of people who are struggling with their mood and their brain energy, and that have early cognitive symptoms that we giggle about. We're like, oh, I've got senior brain, or like we try to
Senior
make
moment.
light of. Yes, senior moment, thank you. we try to make light of that. And for your listeners, I want to say, please don't make light of that. That's not normal, because that is very likely the beginnings of brain hypometabolism. And you can go to your functional medicine person, and they'll put you on all the hormone replacement in the world. And if it's not a hormone, I mean, mitochondria control your hormones, right? So
They control everything.
they control everything. So if you've got the beginnings of brain hypometabolism, I don't, even if you're in menopause and all that, like, take that really seriously. And so consider a ketogenic diet. See how you feel with increased ketone production to rescue brain energy, and see what that's like for you. I think you deserve that option. But it's not normal. I know it's normal, and that it's common.
It's common.
It's common, and we call that normal, but that's not normal.
Mm-hmm.
That's not normal. So we're going to talk about it for mental health, and then there's people with mental illness. And just as I talk about this, understand I'm saying, if your brain is not working well, or your brain is not working as well as it used to, or you're walking around working really hard to regulate your mood all day, that's not normal. So
Yeah.
I'll talk about mental illness and people who identify as, this is what's wrong with my brain. And then there's those of us who just don't identify like that, that are still struggling and still could benefit from this therapy. So
Mm-hmm.
I just want to make that clear.
Okay. And you said something that reminded me of, how people naturally, as they age, they their mitochondria get less efficient, or they start having these things. And I remember, and it was at the Metabolic Health Summit that we were both at, and I think it might have been Ben Bickman or someone who said this. It said that, what was it? Whereas a lot of times people will say people naturally become more insulin resistant as they age. And their argument, and I wish I could remember who said it. Their argument was, actually, we don't become naturally more insulin resistant. We tend to, because of diet and lifestyle, lose muscle mass. We become more metabolically inefficient and become more insulin resistant because of diet and lifestyle choices.
Yeah.
So, and this is something I wanted to ask you later, but I'm wondering now. So is this something, are some of us just like genetically predisposition, like we need this type of diet to function better? Or is this created by our diet and lifestyle, do you think?
I think that, I think, wow. So there's so much we blame on genetics that is lifestyle and diet. There's like the research is just not there to support that these things are genetic. Probably, I've heard researchers say that 95% of the disorders that we deal with are lifestyle and diet, and not genetic. Now, do people have genetic think about it. We all have these different manifestations of symptoms in different organ parts and different areas. Some people have skin conditions, some people have brain conditions, some people they don't detox well, right? Like, I'm sure of course there's genetic SNPs that contribute to that, and make them have difficulty in different environments more so than others. But I really do think that it is mostly lifestyle. And I'm going to say something really controversial, and everyone's going to blow their mind. But I'm hanging with a lot of really smart researchers, and one of the researchers that I heard talk about this, and I think he talked about this at a medical conference also, is that with all of the different improvements of disease states that we see on a ketogenic diet that go away, he has made the comment that perhaps we were always supposed to have access to ketone production in our body because of the stabilizing effects, and that the carbohydrate rich environment that we live in is blocking the production of ketones that we need to thrive, and that our natural human state is supposed to be ketotic, and that disease states happen when we are not in a ketotic state often enough to do the work. Yeah.
That's really interesting. You had an interesting quote that so I want to use this to lead you into my next question. I think it was in your blog. So I'm reading this. I wrote this down on my handy sticky note. And you wrote a blog, which is, I'm sure, controversial, but I'm really interested in it, about binge eating disorders
Mhm.
and ketogenic diets. And you said, in order to have any self-control, you need to have a functioning frontal lobe.
Yeah.
Every parent knows this is true. And
Anyone who's had a head injury knows this is true, right? People who have, yeah, absolutely.
yeah. And so I know we talk about mental health and ketogenic diets and the classic ones. And I think you have an article, a nice article in Frontiers Medicine about using ketogenic diets for mental illness. And you give an example of someone with
Schizoaffective.
schizoaffective disorder, and having a dramatic turnaround.
Yes.
But of course, like we were just saying, you can have a metabolic issue and it manifests in different ways. I always think about that, like when you have high levels of inflammation in the body, everybody reacts differently. And I know when I do, there's certain parts of like my back that I'm like, there it is. And that's how I know my inflammation is up, because that's like my weakest link. That's where it
Yeah.
goes to. Whereas, my friend Amy, who I work with, she has her little spots like, oh, I know because those are my weak spots that it goes to. So for some people, they might get schizoaffective disorder. Some people have bipolar illness. Some people have binge eating disorders or anorexia nervosa. So could you talk to us a little bit about how this plays in, because it flies in the face of eating disorder treatment strategies?
Yeah. Oh, yeah. I know. I do a national board certified counselor continuing education training for psychotherapists, and we go way into this for obvious reasons, because right now, if someone with bipolar disorder or schizophrenia or even just really bad anxiety, it's not only for serious mental illness. We see improvements with all kinds of just general functioning issues, around mood and brain energy and cognitive. But if they go right now, if someone were to go to a psychotherapist right here where we are, they would be told, don't do a ketogenic diet. It's going to create an eating disorder, or it's going to worsen your past eating disorder.
Mm-hmm.
And that is because in clinical psychology, we're supposed to use a biopsychosocial model, and there's a bio pillar of that biopsychosocial model. But unfortunately, because the psychology literature and the psychiatry literature are in two different silos, the psychologists aren't really reading the psychiatry literature that is publishing this information about the neuroendocrine and the neurobiological pieces that are a part of eating disorders, right?
Mm-hmm.
And so that's a shame. That is a travesty, because for someone with a serious mental illness, for example, or really just anyone suffering from anxiety, because we know what that does to our quality of life, right?
Yeah.
And so them being told that is an issue, because for serious mental illness, that could mean dying 20 years early because you're put on a monstrous dose of antipsychotic medications, that impede your metabolic health further and cause you to have a heart attack 20 years earlier than you should. And it also is a travesty because there is a very high suicide rate in bipolar disorder as we're currently treating it inadequately.
Mm-hmm.
And, my goodness, the debilitation of schizophrenia is amazingly awful for these people, and the quality of their life is terrible. And so the idea that
anorexia nervosa is fatal in so many people.
Yes. And so and we weight restore anorexia nervosa, or the doctors weight restore it, but they go home and they still have the same obsessive behaviors around food, and they are still tortured, right? So there is a neuroendocrine and a neurobiological mechanism to eating disorders that current psychology does not adequately take into account and is currently ignorant about in the research literature and not considering.
Okay.
So binge eating disorder has been treated at the Stanford Metabolic Psychiatry Clinic. Many people don't know that such a clinic exists. This is not fringe science, people. Like Stanford on
Stanford
the West
Metabolic
Coast,
Psychiatry Clinic.
yes, has been using ketogenic diets with binge eating disorder very successfully. And what we're finding, or what we suspect, is that the ketogenic diet cleans up the neuroendocrine and the neurobiological mechanisms of that disorder in such a way that they can recover.
And
And
question, do they need to stay on it forever? Or is this a therapeutic that they can wean off onto a healthier, more balanced, or do they have to stay on it forever?
well, so so when we use ketogenic diets for epilepsy, so they've been
Oh,
used
yeah.
for epilepsy for over 100 years, so we have lots of data on that.
Mhm.
And when we use it for epilepsy, we find that people tend to stay on it for 1 to 5 years. And when we do it for adults, we're not doing the classic ketogenic diet, which is 80% of calories coming from fat, like we do for childhood epilepsy. That
Mhm.
is not a modern ketogenic diet. That's not the ketogenic diet being used for any of the mental illness studies. It's a different ratio that's much easier to sustain, much more pleasant to eat. It
Okay.
really is, yeah. I very rarely, so there's different, not, we'll have to talk dietitian, like
Okay.
later on a thing, because we'll bore everyone with ratios. But um, suffice it to say that a modern ketogenic diet that we use for mental illness now, or as a neurological treatment, is very doable and very pleasant, and not this horrible,
Mhm.
constant no protein, all fat kind of thing. It's just not like that. We don't need that for adults, even treating them for epilepsy. So 1 to 5 years, in my experience, sensitive brains, healing brains, because that's what we're doing here. The ketogenic diet is not about symptom control, it's healing a brain. You're
Mhm.
healing a brain. All those things are happening. So the first year, brains are sensitive. You got to kind of stay on it. And my people feel it. They'll be like, oh, I had that mango from the farmer's market and I didn't feel good, because it shut their ketones off, right?
Yeah.
So they feel it and they stay strict, and there's a natural behavioral impact to going off the diet that doesn't feel good. So people have no problem. They stay on it for a good
Right.
year. And then, just like in the epilepsy world, they can start to see what their personal carbohydrate threshold
Right.
is. Most people want to stay in a ketotic state most of the time. So I have people that had to be very strict, 20 grams of net carbs a day for a good year. And then they found they could go up to 40 to 60 grams of carbs, which is very easy to cook with and
Mhm.
eat. And occasionally they will go up maybe to 70 when they go out and there's a little bit of potatoes on the plate with the steak, right? And so that's what it looks like. It's
Yeah.
not, I haven't met anyone yet in my practice. I'm sure they exist, though. I'm sure there are people with serious psychotic disorders that do have to stay 20 grams of carbs their whole life. I
Mhm.
don't know. We haven't done that research, but I don't think it's many people that have to
Right.
do it that way.
And, so as I'm listening to this and imagining other people listening, I would think that the people not pursuing this would be scared of starting a ketogenic diet. They'd be, because I talk to people about anytime they're going to go into a nutrition program, they don't want to change. They don't want to be asked to change. They're afraid of what they're going to have to do. And
Hmm.
this sounds a lot less scary than I imagine they thought it was going to be.
I hear that from people all the time.
Yeah.
So the first thing I do, I'll tell you exactly how I transition people into it. So I get them on chronometer. I'm like, you got to track. You got to
You got to
learn.
track.
You got to track. I know some clinicians don't make people track. I make them track, because they have to learn how many carbohydrates are in things, and there's just no way to master it. I want them to master their ketogenic diet, and I want that data so that I can fine tune their ketone levels if needed. I can't do my work blind, right? So you
Mhm.
got to track. For most people, learning to use the chronometer and getting used to that is the scariest part. they got to get a little food scale and they have to learn to go in grams. But, the tool of Chronometer, for example, is super easy. Like they've made it super convenient. It's doable. So first I have them track the first week, and I have them figure out what level of carbohydrates is their body used to. Sometimes it's 300 grams. I'm not going to transition them fast into a ketogenic diet. They're going to have more electrolyte imbalances. They're going to have more keto flu. They're going to be more likely to go up and down and on and off the diet because they didn't plan appropriately. The behavioral changes have not taken place about what to eat, what to have in the cupboard. So we take that number and then we half it every week. Sometimes we go a little faster. Sometimes we go a little slower. About week 2 or 3, we introduce low carb swap outs, right? We talk about different ways to get carbohydrates down. If someone is a fruit lover and they're like, I cannot live without the taste of fruit, I'm like, okay, we're going to get those natural extracts off of Amazon, and you're going to have a drop of strawberry and a drop of banana, and you're going to have your stevia, and you're going to have your heavy whip or MCT oil or whatever, and an almond milk infusion, and you're going to get your fruit flavor. And it's only a year. We're only going to do this for a year, or even some people say 4 months. And then there'll be a time where you can go to the farmer's market and eat, a third of a mango and be okay, but for now, this is what we're doing. So you just transition them down slowly, and you make sure electrolytes are exquisitely well done. I don't know there's going to be people who listen like, I'm going to do a ketogenic diet tomorrow, and they are going to feel like crap because no matter how much you tell them, you have to take an enormous amount of salt and in nice big amounts of magnesium and potassium for the first 2 weeks, or you're going to feel like dirt and you're going to be like, forget this diet. But so
I think people forget that about sodium when you start taking the carbohydrates out or fast, that salt is so important there.
And that's why it's nice to work with someone like you or like me, because no matter how much we tell you, you have to take your electrolytes. You're not going to take enough. You're going to come to us and say, I feel terrible. And we're going to remind you that you need to do this. And then 20 minutes later, you're going to be like, oh, that's what it was. So you just need to work with someone to help you.
And now I think I read in one of your blogs or your article that when you have medications, dealing with medications and a ketogenic diet, that's a new thing, and it's something you need to pay attention to in a different way. Can you tell me about that?
Yes. So I just got off a call where I was talking to some other colleagues about this. So, and I'm opinionated about this, and some people that I work with in my circle feel differently about this. So I will caveat it with that. So in our attempt to help psychiatrists and general practitioners be more comfortable with people using a ketogenic diet, we have introduced it in such a way that we talk about it as an adjunct. So, and certainly when we're dealing with serious mental illness, medications, I think, are necessary in most cases, right? So, so in that setting, it is absolutely an adjunct. If someone is acutely ill, in psychosis or in mania or whatever, like, I'm not saying, oh, the ketogenic diet's gonna get that under control immediately. There might be a time when, and this is super progressive and controversial to say, but when we have people with treatment resistant seizures, they will fast them in a hospital setting and get them into ketosis as a rescue intervention, right? So I don't know why we aren't doing that for some of these other serious mental illnesses. I think that might be on the horizon. Long time from now. Again, that's just me speculating. But no, please, nobody fast if you're in psychosis trying to get that under control. That's not an appropriate intervention. So let me say that. But we've introduced it to these doctors as an adjunctive dietary treatment. And, we talked a little bit about the effects of ketogenic diets. I didn't even finish that list. Like, it's longer. We could go on about these different pleiotropic effects, meaning multiple effects that work together towards something beneficial of a ketogenic diet. So when people are on medications, and we'll talk about psychotropic medications, for example, they're on a bunch of psychotropic medications. They have a mental health diagnosis, and they go on a ketogenic diet. they'll, the doctor will think of it as, oh, this is a diet like a Mediterranean diet. This is a diet like a vegan diet. This is improving your nutrients, and that's what's going to help. But you still better be on these medications because this doesn't have medication effects.
Gotcha.
A ketogenic diet is not a Mediterranean diet. I'll quote Chris Palmer, who says this. He says, a Mediterranean diet doesn't stop seizures. I can give you all the fish and blueberries in the world, and it's not gonna create a profound metabolic shift in the entire body and brain and change your gut microbiome significantly enough for those changes to stop seizures. It's just not. It's not that kind. So,
and let's say this, that the Mediterranean diet is kind of what you want it to be.
Yeah. Oh, yeah. Yeah. There's no markers. There's no biomarker. Ketogenic diets are the only diet that you can make a biomarker to prove you're doing it right.
It's
right?
quantitative. Yes.
Exactly. So the problem is that as brains heal, because again, ketogenic diet is not about symptom management, although symptom improvement might occur, but it's not occurring because we are, doing something with a medication. It's healing a brain. So as brains get healthier, healthy brains are sensitive. If you and I walked off the street and someone gave us a giant dose of antipsychotics, that wouldn't go well in our brain, would it? No, we would be in bad shape because we have healthy, sensitive brains. But unhealthy brains need big amounts of medications to have the effect. So as a brain gets healthier on a ketogenic diet, the doses that people were on become too high for them. And they start to get weird symptoms. They start to get side effects of those medications. And doctors that are not understanding the ketogenic diet as its own medication effect, so to speak, will say, oh, no, that means you're getting worse. Here's more medication to add on to the already high medication levels that you are now getting side effects from. You can imagine it's a fiasco.
Yes.
So,
and the liability that they've got to make those decisions as a doctor about reducing medications. It's a big one.
I don't envy them. So the way I think, and I'm not a prescriber and I'm very careful not to go into this area, but the way I help people self-advocate with prescribers is I say, you need to talk to your doctor and explain to them that this is a diet that stops seizures. This is not just like a Mediterranean diet. This is not a vegan diet. This is its own type of medication. And please evaluate my medications in the context that I'm already on a medication that is so powerful that it will stop treatment-resistant seizures when all other medications have failed.
Yeah.
And I have found that people bringing that conversation to their doctor and pointing that out and maybe sharing some annotated references with them is a good conversation. And the doctor is more open to reducing medication to reduce potentiation effects for those people.
And I know this is probably impossible for you to answer, if that's not going to stop me from asking it. Like, how does a person make that call between like, wow, I have all these new symptoms coming up. Should I stop the ketogenic diet? Is this what's causing my problems? Or do I reduce medications?
Yeah, that is what often happens. They get potentiation effects, meaning their brain is healthier. They're getting side effects from the doses they're used to be on, or they're on now that are now too high for them. And those side effects are big. Like they say, suicidal ideation. They have anxiety, different symptoms. All of those psychotropic medications have some side effects that look like a worsening of a condition, that look like a worsening of symptoms. So I can't imagine how many people have tried a ketogenic diet, made therapeutic levels of ketone, got good effects, but 3 months later or less, they started getting symptoms again, but it was potentiation and they thought it was, oh, my ketogenic diet isn't working, I'm going to stop.
Right. That's so interesting. And then, here's a question. You touched on this earlier, but exogenous ketones. And so for those of you listening who don't know what this is, you make ketones when you are utilizing fat for fuel. And ketones, it's kind of like you use glucose for fuel or you use ketones for fuel. And we've talked about exogenous ketones, meaning something like a drink with ketones or a pill that has ketones. You can just take them. Is Do you use them in that phase when people are starting their ketogenic diet to increase their levels of circulating ketones? Is that something that you do recommend? Does it help?
I don't too often. So here's why. It's a behavioral reason. So, you remember I said I can never get people to do their electrolytes properly and they don't feel good.
Mm-hmm.
If I have exogenous ketones on the counter, they will reach for that before they reach for the salt. They'll think, "Oh, my ketone levels aren't good enough, or I'm not making ketones I need to," and then they won't salt, and
I see.
they won't do that. But for people who have gone off the diet and need to get back on in a rescue sort of way,
Mm-hmm.
yes, and that no to salt and to electrolyte properly, I will use sometimes MCT oil if they have worked up to it. MCT oil can cause some real digestive distress. I don't
Mm-hmm.
want your listeners to like whip out a bunch of MCT oil and be in trouble. It can cause diarrhea
Mm-hmm.
very easily. And so we work up very slowly in MCT oil. But MCT oil and then also BHB salts can be very nice for people as they're transitioning into a ketogenic diet.
A lot of this sounds like you're like ramping down carbohydrates, ramping up.
On fat. Mm-hmm.
So these are all stages where you take things very slowly
Mm-hmm.
on everything. And that makes sense because whenever I have really, really sensitive patients, or anybody really, anytime you start something new, it works so much better to just start a little bit and ramp things up slowly and let the body, get the system
Adapt.
get used to it and adapt to
Mm-hmm.
it. It's very tempting to just do the big thing right away. It kind of feels good to do a big thing right away,
Yeah. Yeah.
but doesn't work that way, does it?
Well, I get, so I have people that I work with who are just miserable. Like
Mm.
they are in so much distress from the side effects of their medications or their symptoms.
Mm-hmm.
And I will tell them your transition will be much easier if we do it over 2-4 weeks. You'll get less issues. With electrolyte imbalances. I mean, remember the ketones are signaling bodies, and so they are upregulating gene expression and
Mm-hmm.
turning systems on and making them work better. So I think that giving it more time, to adjust is really helpful for people. But they often will be like, I don't care what you say, Nicole. I want to feel better. I'm going to do this thing. I'm like, okay, let's get your electrolytes right and let's monitor you very carefully.
Yeah.
And let's get your support system in place and figure out what you're going to eat, if you do it that way.
Right. So I know we're kind of coming to end of time, but one thing you also mentioned in an article somewhere is, it was the article in Frontiers where it can be a challenge when you're trying to get someone used to the ketogenic diet and that person has an addiction to highly processed foods, the
Yeah.
whatever we call that.
Yeah.
Of course, I see this a lot when I'm just trying to help someone get onto a better diet and better lifestyle, but the addiction to highly processed foods is ultra processed foods. That's what we always call them.
Yeah.
Do you slowly wean them off and then onto the ketogenic diet, or do you do those at the same time? Does it matter depending on the person?
I think it's a clinical decision. So in the studies that came out of Stanford for binge eating disorder, I think it was about 14%. Don't quote me on that. About 14%, I think, met criteria for food addiction,
Mm-hmm.
right? So that kind of behavior. And so they improved on a ketogenic diet. I don't remember if Shabani, the researcher on that, transitioned them slowly into a ketogenic diet over several weeks, or if she did it quickly. But I will tell you, I've worked with many people who use it for binge eating disorder, or even for weight restored anorexia type of behaviors. But for that food addiction piece, it just gets better. The brain you start, here's what I would say. The brain you start your ketogenic diet with is not the brain you are going to sustain your ketogenic diet with. Your frontal lobe works better. Your neurotransmitters are more balanced. You do not feel the need to reach for those foods to regulate your emotions and to self-soothe in the same way, because your brain is healthier.
Gosh. Yeah.
So I think even if in the beginning they struggle with that behavior, I think it gets better. I know it gets better the longer that they keep going at the ketogenic diet, the longer they have periods in its use. And I would say, just like any other addiction behavior, often there are huge psychosocial factors that need to be addressed that, when we address them, help those behaviors.
Mm-hmm.
And so I just think it's a ketogenic diet with good psychosocial support, like we would use for any other addictive behavior. There's a reworking of how we deal with life.
Yeah.
Right. And those reworkings get easier with a better working brain. I have
Well,
so
it's
much
true.
fun doing therapy with people on ketogenic diets because it's easier for them. Their frontal lobe is working better. Their neurotransmitter systems function better. Like, it's just great.
Yeah. I've seen, yes.
Mm-hmm.
I mean, biology isn't everything, but if it's not there, you can't do the psychosocial component.
Yeah. Yeah. And a lot of people just really get mad when we say things like that. But that's part of the promise that medication was going to be, right? When I was in school, it was like, someone is in bad shape, you put them on medication and then the therapy will work better. Mm-hmm. Well, medication did not provide that for people. I know, because I've been a practicing psychotherapist for 17 years. So the idea that we know that a better working brain means better outcomes in psychotherapy, or we wouldn't have said that. That was on our licensing exams, right? Medication and then psychotherapy, we use them together. Well, why can't it be a ketogenic diet and psychotherapy?
Right.
A better working brain leads to better therapy outcomes.
Right. So with that in mind, you have a training coming up in September, I think, for psychotherapists, don't you? Do you want to talk a bit about that?
Yeah, so it is on September 13th and 14th. It's going to be half days. So in the morning of the 13th for 4 hours, and the morning of the 13th, which is a Friday, for 4 hours, and then 4 hours on Saturday. And so that is, I love teaching those. So if there's any therapists listening that want to understand how to support someone on a ketogenic diet, not manage the diet, that's a specialized training, but to be able to give accurate information and to learn how to use your psychotherapy skills in order to support someone in being successful on this diet, then that's a great training to check out. And you can find that on my mentalhealthketo.com page. There's a ketogenic diet resources section where different professional trainings are listed.
Yeah. And so we'll put that in the description here. We'll put a link to Nicole's website in that. And your website also, I think Mental Health Keto is your handle on Instagram as well.
I think
Mental Health Keto.
Yeah.
So we'll list that. And you're also recruiting for a research study on there.
I am. So on that website, there's a link to a ketogenic diet mental illness recovery study where I'm currently recruiting. And it is, I'm looking qualitatively. It's a qualitative research study looking at what is going on for these people who are putting mental illness into remission using a ketogenic diet. And so if someone is self-identified as recovered or recovering from their use from mental illness using a ketogenic diet, and they have some kind of baseline assessment before and after that they can show as the pre-qualification data, then I would love for them to check that out and to send a form to kind of let me know that they're there. Yeah.
Okay. And then Nicole I'm going to put a link here. She's got a great free brain nutrition guide. And she also has a brain fog recovery program that you can check out. And that's on your website too, right?
Yes, that is the online version of what I use for mood and cognitive dysfunction. So it's an online version, and it's really, I really love my online program because I have live Q&As with other people who are in the program who are working on brain health, and it's a great program. Yeah.
All right. Well, I think that kind of wraps up all the sticky note questions I have on my sticky note clipboard. I'm glad we finally got to sit down and talk. I think for those of you listening, I know Nicole's been doing this for a long time, and this is if you're having some issues with mental health and you think this is the kind of thing that could help you, definitely grab her free guide, look at her program, and check out her website. Follow her on Instagram. She's got and her blog. She has a really good informative blog on there too. I highly recommend her as a resource for this. So, thank you very much, Nicole.
Yeah, thank you for having me.